Hello everyone, let's begin with the discussion of another MCQ. The question is, a 6-year-old girl is a known case of thalassemia presented to the emergency room with complaints of weakness, chest pain and palpitations. There is a history of recent blood transfusion and the ECG shows tall and peaked T waves and flat P waves. This is the ECG finding. So what could be the cause in this case? Option number 1, pulmonary hypertension. Option number 2, acute pericarditis. And option number 3, iron overload cardiomyopathy. And option number 4 is hyperkalemia. These are the 4 options. We have to find out the exact or probable cause for this condition. So now in case of pulmonary hypertension, it is a known case of or a known complication of hemolytic disease like sickle cell anemia as well as thalassemia. So hemolytic disease means the RBC destruction is faster than their synthesis. That is called hemolysis. Because of hemolytic anemia, there is a bleeding occurs. So it is a known complication of hemolytic disease, and here free hemoglobin and angiotropic factors causing vasoconstriction, but the ECG finding it shows the features of right ventricular hypertrophy, but the ECG findings are not suggestive of right ventricular hypertrophy in this case. So second option, acute pericarditis. Here the patient presents with fever and diffuse ST elevation. So ECG does not represents the ST elevation in this case. And option number 3, iron overload cardiomyopathy. So here the patient presents with features of cardiac failure and ECG shows ventricular arrhythmia. So there is no feature suggestive of ventricular arrhythmia in this ECG findings. So here the tall and peaked T waves and flat P waves along with history of recent blood transfusion, it is suggestive of hyperkalemia. So increased in the potassium concentration. So this hyperkalemia occurs due to blood transfusion. What is the reason? Because stored blood has increased concentration of potassium due to failure in the sodium potassium ATPase pump. So the probable cause for this weakness, chest pain and palpitation, and ECG shows tall and peaked T waves and flat waves suggestive of hyperkalemia. That is the probable cause. That is option number 4 is the answer for this question. Thank you all.